Hi, everybody. This is Dr. Daniel. Today I'm talking on Emgality, which is galcanezumab, treats migraine and photophobia 2023. Well, part of the problem of having a migraine headache is to also experience sensitivity to light at the same time. Light sensitivity always makes the restriction of the headache worse. Light really hurts so much during that time. There also may be intense throbbing, headache pain, feeling worse with standing, sensitivity to sound, and nausea, vomiting. That's a lot of suffering. Altogether, a terrible experience. Emgality injection prevents both migraine and photosensitivity. This is impressive for a CGRP-type migraine preventive drug, which has few side effects. All of the CGRP drugs may have a 50% reduction in migraine headache and reduced light sensitivity, yet Emgality has been found to be especially effective for treating photosensitivity. Emgality is once a month injected monoclonal antibody that inhibits calcitonin gene-related peptide, CGRP, a vasodilator. Emgality is also effective for the treatment of cluster headache and is one of the 3 monoclonal antibodies available for migraine prevention in adults. Well, the comments regarding photosensitivity come from an article written by DiCola et al. In Front Neurology, January 23. It was entitled Photophobia and Migraine, Outcome During Treatment with galcanezumab. So what are the side effects of Emgality? Serious side effects are hypersensitivity reaction, while common side effects are an injection site reaction, muscle cramps, or spasm. How effective is Emgality for treating photophobia? 68% of patients treated with Emgality had a significant improvement in photophobia. Half of the patients had improvement within the first month of treatment. I have an article on migraine and photophobia, which you could also look at. And if you look at this article on my blog, you can click it to get there. What's the most bothersome symptom for migraine? This is a really interesting study. It's called MBS, Most Bothersome Symptom. And neurologists have done studies and looked at this. So Munjal et al. In an article in the journal Headache entitled Most Bothersome Symptom in Person with Migraine Results from the Migraine in America Symptoms and Treatment Study. They call it the MAST study. The objectives were to determine the rates of nausea, phonophobia, and photophobia recorded overall as the most bothersome symptom in individuals with migraine, and to identify individual characteristics associated with each of the 3 candidate MBSs. The conclusion was that people with migraine in the MAST study reported all 3 cardinal symptoms were bad, but the most common one was photophobia. Photophobia improvement was also more frequent in patients with episodic migraine and patients who were triptan responders. So, what is this deal about photophobia and migraine? Photophobia occurs in many ophthalmic and neurologic disorders, but most commonly in migraine. And it's one of the criteria for diagnosing migraine according to the International Headache Society. Photophobia has been defined as hypersensitivity to light, which causes avoidance of light and is the most bothersome associated symptom of migraine. So good news, folks, if you have bad photophobia and your migraine, you might consider getting your doctor to give a trial of Emgality. So I hope this information has been helpful to you. Please click on like and subscribe down there, and I'll see you again on the next podcast.